Hi guys, my name is Rumanak and this is a follow-up video for my injury. So I got into a freak injury on 23rd of December 2022, and we went on a desert safari in an area called Jahara in Kuwait, and I was on a quad bike, and we were riding it uphill and downhill, and I happened to just launch my vehicle in air, and it turned mid-air, which caused the tires to fall on my leg. I had broken my leg immediately, so I had a bimalleolar fracture in my ankle, and my medial malleolus and my lateral malleolus broke. So I had an ORIF surgery. So it is basically open reduction internal fixation surgery in my ankle. So my medial malleolus was fixed by using tension band, and my lateral malleolus was fixed by using a screw. I have already posted all the details of my accident, my injury and my surgery in my previous video. So in case you have not seen that video, you can go and check it out. Unfortunately, if you are injured and you want to see what's my experience was. So this is the second part of my injury update. In the last video I had already told you all that my staples were removed, and after about 5.5 weeks the doctor took the x-ray again when I went to show the doctor, and they decided that they can remove the cast. So I had a plaster cast and they removed after 5.5 weeks, and they told me that I can start partial weight bearing at that point, and until that point I was non-weight bearing. So I started partial weight bearing at 5.5 weeks, and they asked me to use 2 crutches and walk, and until that time I was using 4-leg walker. So once they removed the cast from my right leg, it looked malnourished when they took it out, and the veins were sticking out of my leg, and it was very thin, and it looked dry. Even my thighs were significantly thinner than the other thigh. My calf muscles were almost gone, and there was only fat there. Once they took the plaster off, my skin was very dry, and I tried many things, and then I noticed that I had to be patient with my skin, and the best solution for me was that washing my leg with lukewarm water and using a little bit soap. Once I washed my leg, I used to dry it with a towel very gently, and it took around a week or 2 for my skin to become normal again. I had another appointment on 16th of February with the doctor, almost after 2 weeks of opening my plaster, and this time the doctor told me that they are extending my partial weight bearing upon checking the x-rays, and they told me that now I can start walking using 1 crutch only. Until that time I was still using the 4-leg walker. I was not using the crutches to go outside because I was using the 4-leg walker from the starting, and I felt that it was best for me at that point of time because I was not very comfortable with the crutches. So I stuck with the 4-leg walker. I was not that confident with the crutches, so I used a 4-leg walker. But when the doctor told that now I can use single crutch, so I also tried from my side so that I can start using 1 crutch and walk with it. And about 8 weeks after my surgery, I was confident enough to use a single crutch, and since then I am using a single crutch to walk. So today is 20th of March, and it's been almost 85 days since my surgery, and I'm still walking using a crutch, a single crutch. Once the doctor opened my cast, the range of movement of my ankle was very less. So it was just doing that like this much only. But then constant physiotherapy and exercises, it's improved a lot from that point. It's almost to the point where I can say that it is around 50%. It's not same yet, I am not sure that it will be same ever again. I will get the same range of movement in my injured ankle ever again. But I hope that constant physiotherapy will improve it. So there are 2 3 things. Once I got injured, I searched many YouTube channels and saw videos, and the people with experiences like me, trying to learn from them. So in one of the videos, one of the guys told that once they put the leg down from the bed, it seems that all the blood is rushing down towards the ankle every time they put the leg down from the bed. And it happened to me, but it happened to me only around maybe 2 3 days, 4 days, 5 days max. But after that it didn't happen to me. Another thing which the people talked about in their experiences was they were once they keep the leg down after a long time from the bed, or in the morning maybe, it feels strange, and the leg does not feel as powerful, as ready to bear the weight once they keep the leg down after a long time. So this is happening with me. So once I am taking a rest for a long time, or I am getting up in the morning, once I keep my leg down, it feels that I don't have that muscle memory in my leg, that I can just get up and start walking. So I'm little bit struggling with that at this point in time. I have to stand, I have to give some weight, I have to tell my leg that okay, you have to take this much weight, and then I limp before I start walking a little bit better. So at this point in time, I am limping a very little bit with a single crutch. I try to walk as straight as I can. Another thing is that walking in shoes and walking on barefoot is very much different. So it's like day and night. So walking on shoes is pretty comfortable, and walking without shoes, walking barefoot is not as pleasing. Even we have a carpet in our house, but still walking on barefoot, it doesn't pain in the ankle for me. I don't have pain in my ankle. Thank God I didn't have any kind of injury related pain from the moment I got injured. I only had pain after my surgery, that too for 8 9 hours after post surgery. I was in sheer pain. It was too much for me. But once that pain subsided, I didn't had any kind of injury based pain. So even my ankle, if I walk too much, it little bit it hurts, but it does not feel like, thank God it doesn't feel like it's paining all the time. So that's a very good point for me. But once I started walking with single crutch, so I was putting little more weight on my leg, I have noticed that my foot was paining. So I read about it, and I noticed that muscles in the feet are also getting weaker once we put them in a cast. So probably my muscles in my feet were weakened, and gradually I am a little bit feeling better. So my feet is not paining as much as it was paining before. So there are several exercises also for strengthening the muscles of the feet. So I checked with my physiotherapist also about the exercises for the foot, and it got better. So time for a reality check. Frankly, I didn't thought when I got injured that it would take so long. It's been 85 days until now, and I am using a single crutch to walk, and I am limping ever so slightly if I am limping. But I am very patient person, and I am ready to adapt. So I am adapting to this new reality, and trying very hard to get back to normal as soon as possible. My injured ankle is still 10% bigger than the normal one, and it gets even bigger if I do some exercises. Yes, it depends. Sometimes it does not get swollen, sometimes it swells. One more thing I would be thankful to God is that the metals which are a part of me now, are not creating any drama at this point in time. So we are in a kind of symbiotic relationship, and I hope that it will remain forever like this only. I don't have any problems related to metals. So the next step is, after 2-3 days, on this Thursday, on 23rd of March, I have to go again to the doctor. Hopefully I will transition in full weight bearing at this on coming Thursday. So that's it for this time, and this is all the update I have about my injury. I will update you about my recovery in the coming videos as well, and I wish for everybody to have good health. And if unfortunately you are here and you are injured, I wish the best for you. And also I would like to tell you that you have to be very patient with this kind of injury. It takes time. I hope the best for you, and I hope the best for me also. I pray for me, I pray for you also. So this time will pass away, this time will go away. Just have to be patient, and see you on the other side. Bye bye.